Assalamualaikum, very good morning, and we're going to continue interpersonal psychotherapy, a series of clinical psychology lecture in psychotherapy section. So basically, like we have discussed before, in each psychotherapy, normally when they develop, it's influenced or based on a theory. Interpersonal psychotherapy developed basically based on the work of Harry Stack Sullivan, who is also a follower, a very close student of Sigmund Freud. Originally, interpersonal psychotherapy or IPT is known as IPT, developed by Gerard Clement and Myrna Wiseman in the 1970s. They start working on it around 1968, and they also use a theory behind the work of Harry Stack Sullivan, Adolf Meyer, and also John Bowlby. If you are familiar with Harry Stack Sullivan, he emphasizes so much on the importance of relationship, interpersonal relationship, and Bowlby works so much on attachment theory. So interpersonal psychotherapy is a type of therapy that utilizes a unique structure model for treatment of mental health issues. Originally, it was developed specifically for depression. Like I mentioned before, it was mostly based on attachment and communication theories or relationship theories. So it helped to people or patients to address their current mental health concern and to improve interpersonal relationship. So it is a very focused type of psychotherapy. It was brief and mostly initially developed for depression, and they strongly believe that the biggest factors that contribute to depression is a social network of the patient. Social network meaning that relationship or a social relationship surrounding patients. Okay, so they strongly believe that depression is a result of disturbed social relationship. If you don't have good relationship, it can cause you depression, or at least unsatisfactory interpersonal relationship. So these two things, disturb social roles and social relationship and interpersonal relationship, they have some kind of interaction in fact. So the other thing is that sometimes social disturbed relationships can also be defined as absence or loss of significant others at old age. You have grief, for example, when you were young and you lost your parents, someone you love, or you lost your grandparents who were very close to you, and it can, if you do not address this issue earlier, so it can cause a depressive disorder. Now the thing is that the depression can disturb a relationship. It leads to more depression. So we strongly believe in IPT that once we address issues related to relationship, it can speed up the process of recovery in a case of depression, for example. Now, this is some framework by interpersonal relationship that explain cause of mental disorder. So basically, disturbed relationship can cause depression. Depression can cause more relationship disturbance, and more relationship disturbance can cause more depression, and more depression can cause a disturbed relationship. Now, the other aspect that you have to look at when we talk about causes, we do not, IPT also do not deny the contribution of biological factors, history of families or mother and father who have depression. This is what we call physical health problems, also can contribute depression. If you've been diagnosed to have diabetes, for example, you've been diagnosed to have schizophrenia, not schizophrenia, I mean cancer, physical health. It can cause that's what we call biological factor that can cause depression. In addition of the social factors, for example, distant relationship with mother, distant relationship with husband, good social network, at work, withdrawal from friends, for example. You used to have a very good relationship and social network from your friends at work, and then suddenly you do not have that. It can cause also depression. And the psychological factors is that is something within you, within the patient themselves. Insecure attachment style, we talk about it when you take introduction to psychology. Avoid expressive, when you the kind of person who like to avoid expressing negative emotions, and you are the type of person who are very assertive, and it can cause depression. And the combination of these three things can have interpersonal crisis. We look at example Jill, for example, and interpersonal crisis can lead to interpersonal dispute with mother and husband, and if we do not treat this, it can cause major depression. All right. So goal of interpersonal psychotherapy is to reduce symptoms of depression, for example, or other mental disorder, bring changes in the patient, close interpersonal relationship. That's the focus, and develop new strategies to deal with significant others. And sometimes we in interpersonal psychotherapy, we also run session for family as well, and those who are involved, or people surrounding the patient, so we can educate them about the importance of family relationship. Um, Interpersonal psychotherapy also focus on preventing recurrence of depression. We strongly believe that when we resolve issues related to interpersonal relationship, it can reduce more symptoms in the future. As a result of that, hopefully it will prevent recurrence of depression. So in general, basically, we strongly believe, we practice IPT, practice active non-judgmental treatment in order to help patients in therapy to successfully handle the challenges in mental problems and also improve their mental health. Okay, and there are a few things that might be, although IPT was originally developed to improve or to help depression, it can also cover other mental disorder. For example, is role disputes, conflict, interpersonal shortcomings, life stage transition. What is life stage transition? Retirement, for example, or newly parents to become parents, or newly married couples. That's what we call life stage transition. Relational conflict, husbands and wife at workplace. Grief, when you lost your parents, when you lost your loved one, you're gonna go through grief, and other attachment issues. So IPT is very well proven in a few studies that it was found to be a really effective treatment for depression, and has been modified to also treat other mental disorder, for example, anxiety. disorder eating disorder, dysthymia, substance abuse issues, bipolar, postpartum depression, social phobia, and also post-traumatic stress disorder. So basically, interpersonal psychotherapy, a type of psychotherapy that emphasizes so much on a relationship. There are a few books that is really important if you really want to study more. Interpersonal Psychotherapy, a guide for clinician by Stott and also Robertson. There's another one. Uh, this is by Myrna, of course, and also Clement themselves, Weisman, and also Clement themselves. They have produced so many books for interpersonal psychotherapy. They also have books. Clement and Weisman have interpersonal psychotherapy of depression and a book that guide you how to do it, focus and very briefly. Yeah.